I'm Dr. Karthikeyan. You might have been noticing we've been doing some of these videos over the last few months, mainly to help with patients, to give them information, and also to help them understand the various different modalities of treatment which is available in integrative medicine. I hope these videos are also informative enough to help my colleagues and doctors to understand what's going on here. Thank you. Now, I would like to discuss today about one of the topical things which is happening, which is we have seen a news report in the last few days wherein AstraZeneca, one of the leading vaccine manufacturers, has admitted to some of the side effects of the vaccines, which is the thrombosis and thrombocytopenia. Now, this thrombosis and thrombocytopenia, vaccine-induced thrombocytopenia, has claimed lives of many young vaccinated individuals during the last few years during the COVID vaccination drive. This is a very serious side effect which initially the vaccine manufacturers did not issue warnings to. Now, what I would like to say is, this is of course something which manufacturers and the government agencies and the regulators will be looking into very closely with regard to this particular side effect, and which AstraZeneca Covishield vaccine, which one of the vaccines done in India, Covishield, was actually done in collaboration with AstraZeneca. Hence, the cause for concern in the Indian population. The other part which I would like to talk about is the COVID illness. Post-COVID, the health of the community as a whole has gone down several notches. And if you ask me, I as an individual practitioner can quote so many different patients with so many different problems. For example, we have seen an increased incidence of diabetics. The patients after COVID have started falling like 9 pins, is what we can say. The number of diabetics in the population increased tremendously. If you ask the dental surgeons, they would say they are seeing an increased number of dental abscesses. If you ask the general surgeons, they will say they are seeing an increased number of anal and perianal abscesses. If you ask the oncologists, they will say that they are seeing an increased number of cancers, and they're also seeing something called turbo cancers, which are cancers which are accelerating at a very huge rate. If you ask the autoimmune guys, and their increased incidence of autoimmune diseases. I recently saw a child, 9 years old. In fact, I didn't see the child. I saw the child's mother, who is a nutritional health coach, and she was getting treatment at the local cancer center for a brain tumor. I knew that we did not have a vaccination policy for children in India at the time, certainly not that young. So I, in my history taking, asked her, okay, the child she hasn't been vaccinated, has she? But mom told the unavoidable truth. She has had 1 dose of vaccine when she was living in the US, and the US has policy of vaccinating children after the age of 5 at that point in time. So we are not doing any blame theory here. We're just talking about what are the kind of illnesses which has increased after the COVID pandemic, and these are the kind of illnesses which have shot up through the roof. In my experience, I have seen a young 29-year-old with Parkinson's symptoms. It's very distressing for the entire family when such a young chap has to go through such an illness, which is usually designed, or usually it's an age-related degeneration. So how do we tackle these things? We now that the awareness, now that the cat is out of the bag, as they call it, now the people's level of awareness is much higher because of the news in the media, and people are now searching for what are the modalities that we can reduce our risk with. Now, we all know that during the pandemic and after the pandemic, even if you look at the UK data, let's say the Office of National Statistics UK data, COVID-19 infection survey done as late as in March 2023, 41% of the respondents say they have a lot of the chronic symptoms, illness related to fatigue, shortness of breath, and symptoms of long COVID and things, as long as 2 years after the initial infection. Now, these are illnesses which, for the length of time that they are having these symptoms, is very unusual. And we know we already have evidence of all neurological dysfunction and psychiatric dysfunction due to is exacerbated by viral illnesses. For example, we know Epstein-Barr viruses is one of the cause of multiple sclerosis. What can we do to help? How can we offset the spike protein damage which has already happened in your body? Already the inactivated viruses has in your body has triggered various parts of your immune system and it's having its antibodies. We can offload them by doing a program to offload your spike protein, which consists of a few nutraceuticals. Basically, it consists of various treatment management modalities. Depends on what symptoms currently the patient is having. If it is the symptoms are mild, we can use oral nutraceuticals and oral upgrading your nutritional status and helping you detox whatever is going on. If there are significant symptoms which are actually causing a disability in your day-to-day functioning, then we can also give you IV nutrition and other ozone and other forms of treatment which can help detox your system and help you get back to better health. Thank you.